8:36, welcome back. Child advocates worry that increased hardships due to the coronavirus pandemic could have long-term negative physical and mental health impacts on kids, which is why the Florida Department of Education is making $2 million available to rural counties across the state to increase access to telehealth to provide mental health services for kids. Joining me now is Dr. Catherine Drew with Florida Psychological Associates. Good morning. Thank you for being with us this morning.
Good morning. Thank you for having me.
So for starters, how is the pandemic continuing to impact children in our area?
So what we know is that students who are participating virtually have an increase in mental health needs, as well as those students who are in the traditional brick and mortar classrooms. We're seeing an overall increase in mental health needs, and the staff that we have in the schools are reporting that we're seeing an increase in suicidal thoughts and severity of mental health symptoms.
And so with that being said, why increase funding for telehealth services and not just traditional in-office services?
It's critical, especially in the areas that have less resources, like our rural counties, that we connect those folks who were participating in mental health services before the pandemic. We continue to connect them to services. Also, those who identify the need for more support since March, we want to make sure that there's no additional barriers that prevent them from connecting to quality mental health services. Similarly to physical health, so if you were seeing your physician before the pandemic, we want to make sure you're connected. It's the same with mental health, connecting you to therapy as well as medication management.
And you mentioned it briefly, but I want to elaborate it on a little bit more because kids are still learning from home. A lot of kids in our area did choose that option heading into the school year. What are the biggest changes in children's mental health needs since learning from home?
So we know that isolation and increased stress is difficult for all of us, children and parents. And so we have an increase in financial stress for a lot of families, as well as physical health stress. So what we are seeing is that with that, there's an increase in mental health symptoms and stress overall, and there's things that we can be doing to combat that as families and as school districts.
And what tips do you have for parents to help with these types of things?
So first, having a conversation where we're acknowledging that stress and mental health support is important for all of us. And then monitoring your stress and mental health symptoms as well as your children's. We know that early connection with a mental health provider is very important for outcomes, and telehealth is one way that you can do that from the comfort and safety of your home.
What other services are also available here in Northeast Florida for families who may be able to relate to this?
So telehealth is a interesting addition to our what we call our toolkit of services. Most mental health organizations also have live services for you to participate in. We have websites that have more tips and general support to help you engage in pleasurable activities, the things that we know help folks be healthy overall, and of course connection to telehealth.
Such an important topic, Dr. Catherine Drew. Thank you so much for being with us this morning.
Thank you.